Winter is when we see a lot of respiratory infections in children, particularly infants and toddlers. And one of the most important types of respiratory infection is bronchiolitis, which is caused by the respiratory syncytial virus, or RSV. It is probably the most common reason for hospitalization of infants, with an estimated 125,000 hospitalizations each year in the United States alone. Unfortunately, approximately 250 children die each year from respiratory illnesses. The vast majority of cases are much less severe. It begins with symptoms that suggest a cold. Cough, runny nose, fever, nasal congestion. But in 40% of cases, it can progress to lung disease with small airways involved, thick secretions, make it hard for the children to breathe. And when it's hard to breathe, they tend to take small breaths and to have to take them more frequently. In other words, they breathe faster. In addition, when they're having a hard time breathing, they often don't eat or drink well, and then they have fewer wet diapers and can become dehydrated. The most severe cases are often those that are with children that have some high risk, such as very premature infants, infants with certain types of heart disease, and kids that have certain types of chronic lung disease. Number one, they can provide supportive care. That means encouraging their child to eat and drink. It means probably keeping children that are healthy away from those that are ill. They can give some Tylenol or ibuprofen with the guidance of their child's doctor. The second thing that a parent can do, though, is to be on the lookout for when it is that their child might be worsening. When do I take them to the doctor? One reason to take them to the doctor is if they're they're having a difficult time breathing. With bronchiolitis, of course, they breathe fast. A normal, healthy newborn should probably breathe about 40 times a minute. Toddler, probably about 25 to 30 times. So take out your watch and for an entire minute, count your child's breaths. If your child's breathing 60 or 70 times a minute, you probably should see the doctor. Or if in your opinion your child's having a tough time breathing, for example, you notice that the belly is moving with each breath, or you notice that the ribs are caving in with each breath, or you notice your child's nostrils are flaring with each breath, or maybe an infant has a head bobbing with each breath, that's probably a good reason to see the doctor. If you find that your child's not eating or drinking adequately and you have fewer wet diapers, that's probably a reason to go to the doctor. And finally, anytime your child is poorly responsive to you, please go to the doctor. The doctor is probably going to tell you one of two things. Either he or she's going to give you some reassurance and some guidance that what you're doing is working and to continue doing that. That's probably the majority of cases. Or he or she may recommend that your child be admitted to the hospital. That's much less common. One would be if your child's not drinking well and is becoming dehydrated. The second is if your child needs extra oxygen, and you won't know that at home. Thirdly, if your child is really having a tough time breathing and is going to need help, that would be a reason to hospitalize. We often spread the disease by touching contaminated secretions, so washing your hands after you've taken care of your child. But also we've found that the virus can live on hard surfaces for multiple hours. So to protect other children, it's probably a pretty good idea to keep things clean, whether that's cribs or toys or tabletops or utensils. Unfortunately, having RSV in the past doesn't prevent us from getting it in the future. In fact, some kids can get it twice in one season. There's also no specific vaccine that prevents RSV. There is a drug that can be given that's given with shots monthly, but that's really only reserved for those children that are at very high risk. So how about the rest of us? What can we do? Well, we can provide good hand hygiene, washing our hands, keeping things clean that the child has touched. Another thing, though, has to do with tobacco smoke. Tobacco smoke exposure is well documented to increase the risk of serious respiratory infections in children. And remember, smoke does linger on our clothes, so just because we smoke outside before coming into the house really doesn't protect our child. So that's probably a good reason for parents to seriously consider a smoking cessation program. How about breastfeeding? Breastfeeding has repeatedly been shown to be protective, to help decrease the risk of serious infection and prevent hospitalizations. This time of year, when RSV bronchiolitis is so rampant, this is a good time for parents to stay vigilant and watch for any infections in their children and provide good supportive care, but at the same time being careful to watch for when that child might need to go to the doctor.